This is a pilot study to show that we are able to deliver a mesh into the abdominal cavity in a sterile fashion using NOTES techniques. This is a follow-up study after benchtop studies to demonstrate that a mesh can be delivered through the mouth and stomach sterilely. The benchtop studies were followed by a series of non-survival studies to develop the NOTES techniques. This pilot study sets the stage for NOTES transgastric hernia repairs in humans. Here you can see the mesh delivery system that was developed for this technique. 4 sutures were placed in the mesh before placing it into the system. 1 ethibond suture was placed at the inferior pole, or the 6 o'clock position, and 3 Gore-Tex sutures were utilized at the 3 o'clock, 9 o'clock, and 12 o'clock positions. The mesh was then rolled up and placed into the delivery system. Here is a final view. Access to the stomach was obtained with a needle and wire. The channel was then flushed with iodine solution. A snare was utilized to grasp the wire. A balloon was then passed over the wire. The balloon was then inflated to create a dilated gastrotomy. The inflated balloon was then passed through the gastrotomy into the peritoneal cavity. A new wire was then placed in the lower abdominal wall. The endoscope and snare were then removed entirely, bringing the wire up through the esophagus and out of the mouth. The mesh was then delivered over the wire. The endoscope was then reintroduced and the channel was flushed. The mesh was then unrolled. Using a grasper to hold the sutures, the mesh was then pulled into appropriate position. The sutures were then placed through the full thickness of the abdominal wall using a looped spinal needle and a grasper. We began with the most inferior suture. The lateral sutures were brought through the abdominal wall next. The superior suture was placed last. On occasion, it is not possible to grasp only one of the 2 suture ends. Therefore, both can be pulled through the loop at once. Once both sutures have been pulled through the abdominal wall, one can be pulled back into the abdominal cavity, and then this passed through the spinal needle again. The sutures were then pulled tight. A nitinol tack was placed at each corner of the mesh. One of the tacks was not placed in an ideal position, therefore we decided to remove it. Here you can see that the tack has been replaced. And here is a final view of all 4 tacks in good position, with the mesh in proper position. The gastrotomy was then closed using a padlock device. A dual-action grasper was utilized to grasp each side of the opening of the gastrotomy. And the padlock was deployed. Here you can see a view of the mesh in situ at the necropsy. This is the external gastrotomy closure. Here is a view of the internal gastrotomy closure with the padlock device still intact 2 weeks later.